Skin cancer is one of the most commonly diagnosed cancers in the United States. And now there are new treatments for the two most common forms. Dr. Ajay Bhatnagar, Medical Director of 21st Century Oncology, along with his patient, Ricky Cox, they're here to tell us more about these treatments. Great to see both of you. I want to start with you, Dr. B, as they like to call you. What are the most common forms of skin cancer?
The most common forms are basal cell and squamous cell carcinoma. About an incidence of 3 million per year, with about 75% representing basal cell carcinoma.
But the good thing is the cure rate is very high on these two forms, correct?
The cure rate is excellent. It's highly cured. Once just needs to be treated early, and it has excellent cure rates.
And there's new treatments out there for patients. Tell us about this revolutionary new treatment.
Yes, there are new treatments out there now, and non-invasive treatments, so an alternative to surgery. And so one of them is called electronic brachytherapy, where we actually apply a radiation source to the skin lesion using a surface applicator.
So this is like radiation then?
It is. It's it's a new form of radiation therapy.
Is there pain involved?
It's painless, non-invasive.
Okay, so Ricky, I want to come to you because you have suffered with skin cancer for many, many years.
Correct.
And you have gone through the surgery, which is, as Dr. B pointed out, is one of the most common treatments for this. And then you were introduced to this radiation option.
By my wife.
Tell us about it. Tell us about your skin cancer.
I've had skin cancer removed on several areas of my body and wound up. My wife was watching Sonoran Living Live, and Dr. B was interviewed about 4 years ago, and she showed it to me because I had had skin cancer removed on the bridge of my nose and had had it surgically done by a plastic surgeon, which left me with 17 stitches and a stitch from here to here and here to here. Oh. I looked like a raccoon. But I sent Dr. B an email, and he emailed me back, and I went and did the 8 treatments, and it was awesome. I loved it. It was fantastic.
And it was quick and easy. And we don't have before and afters of you. We don't have before and afters of Ricky, but we do have some before and afters of some other patients. And who was an ideal candidate for this, Dr. B?
Ideal candidates are generally men and women over 50 with basal or squamous cell carcinoma that have lesions in cosmetically sensitive locations, such as the face, the ears, the nose. Or patients that are not candidates for surgery, whether they're on blood thinners or have a lot of medical conditions that make them not ideal candidates for surgery.
So Ricky pointed out that he looked like a raccoon after the surgery, and he had just a small little Band-Aid right here after he had his nose done. And so he's a perfect candidate for something like this.
He was an ideal candidate and had an excellent outcome.
So what should we, because we live in Arizona for heaven's sakes, I mean, we're always exposed to the sun. Can you give us some reminders about prevention?
Yes. Some reminders is, first, avoiding the sun, especially during the peak hours of 10 to 2. Others is sun protection, using sunscreen, usually an SPF of 30 with UVA and UVB screen, and reapplying it often, especially on the tips of your nose or your ears. That's essential to reapplying.
And how often do we have to get these radiation treatments?
These radiation treatments, when you have the skin cancer, is generally delivered twice a week for a total of 8 treatments.
So 8 treatments, and this is a video right now of someone getting it done. He looks like he's resting. He doesn't look like he's in any pain at all. So over an 8-week period. And would you recommend
4-week period.
4-week period. Would you recommend this, Ricky?
Absolutely, I would. It's fantastic. I tell every one of my friends about it. I think it's the greatest thing going.
Because you've had friends who also suffer from skin cancer.
Correct.
And they
big
have
scars.
Yeah, and you're saying stop cutting on
Absolutely.
yourself. Oh my goodness.
Crazy.
So and everyone's telling you, Dr. B, that this is the way to go for them.
For a certain subset of patients, this is an ideal treatment. An
ideal treatment. Okay. Well, thank you so much for that information. Very useful information. We want to give you some information now. 21st Century Oncology is located at 7340 East Thomas Road in Scottsdale. If you would like to make an appointment today, call 480-945-6896, or you can visit them online, 21stcenturyoncology.com.